Hi, I'm Jada, founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers like doulas, lactation consultants, and mental health therapists. And today we are talking top tips to getting breastfeeding or chest feeding or lactation off to the best start. So, number one, you want to talk to your midwife or doctor now, and you want to ask, how are you going to help me breastfeed, right? So you want to set up that conversation first so that they know what your intention is and that they can take the best practices to help you along. Two, you want to ask, if all is well, can I keep my baby in skin-to-skin contact directly on my chest after I give birth and until the baby has initiated the first latch? It typically takes an average of 25 minutes to 45 minutes before your baby's even going to start to show the signs of hunger and start to get ready. So ideally what we want to do is be able to place that baby in skin-to-skin contact provided all is well. And if everything is well, we want to ask, can I delay all the newborn procedures until after lactation is initiated, right? So some of those newborn procedures and whatever hospital or birth center you're giving birth in or at home, they vary. But typically we're looking at things like eye ointment to protect the baby from bacterial infection. We're looking at vitamin K shot to help the baby be able to clot their own blood. We're looking at weighing the baby, right? Various procedures like this. So the goal here is to delay all those procedures. That's what the American Academy of Pediatrics recommends. We delay all these newborn procedures and we wait for the baby to start doing what the AAP recognizes that babies can do. It's called the breast crawl. So if you're kind of laying back like so, right, and you place the baby in skin-to-skin contact, that baby can crawl up and latch on. Now that will take like 25 minutes to an hour, and you'll of course not be standing like I was. You'd be laying back in the bed at that point and allowing that baby to do that. All mammals crawl up to the nipple, right? They'll lick and they'll suck for a little bit and then they will latch on. And often when they're coming from below, they actually latched in the best way possible. So that would be a great thing, is trying that laid back position, delaying the newborn procedures, seeing if they'll allow that and allowing that baby to kind of crawl up and do their thing. Other things that will help in terms of tips for getting off to the best start are just knowing when to call for help. So pain is a clear sign that something's not going correctly with breastfeeding or lactation. And if that is the case for you, you don't want to wait until the pain is so bad that you can't handle it or you don't want to place the baby. You don't want to nurse the baby. So really reaching out to Boober, to a lactation consultant, if you reach out, the sooner you reach out, the more likely you are to successfully work on fix that problem that you're having that is causing some of the lactation issues and pain. Because if you're having a lot of pain, pain will lead to less nursing, and less nursing or less productive nursing leads to less breast milk production. And that's another thing that you really want to learn about, right, is how breast milk production works. So if you understand that you have to place that baby at the breast or chest multiple times per day, and when I say multiple, I mean like 8 to 15 times, right? So 8 to 15 times per 24 hours, we are going to allow that baby to suckle, and that suckling is going to stimulate my nipple and breast tissue, which is going to send a signal up to my brain. The hormones like prolactin and oxytocin get made in my pituitary gland, right? And that stimulation from the nipple stimulates my pituitary to create these hormones, which then tells my body to make milk. So you really have to understand that the more milk that goes out means more milk that you'll make, and the less milk that goes out means the less milk that you're going to make. So it's really critical to allow the baby to nurse whenever they want to, completely unrestricted access. And in those first few days, your baby is actually building your milk. So the final thing I'll say for this video is just understand that teeny tiny bits of the new milk, which is called colostrum, the early milk, doesn't look like full flowing milk. And if you understand that, you'll understand, oh, my baby is just getting these teeny bits, but that's also stimulating me to tell my body, hey, I was born, I need a certain amount of milk. And if we give complete unrestricted access to the breast or chest over those couple, 2, 3, 4 days, then we should see the full flowing milk coming in. And so, just last things to say are that if you're having problems early on, again, reach out for a lactation consultant. You can come to Boober. We will match you to somebody same day, virtually wherever you are. We also do in person when it's safe and depending on where you are. But we can serve everybody with virtual consulting, and that can really make a difference. So reach out if you're having pain, low weight gain, you're just feeling awkward about it, it's hurting, or it's just a bit uncomfortable, you're not sure, and that's, reach out, and here we are.